Our next topic is Attention Deficit Hyperactivity Disorder, or ADHD. What is ADHD? It's a condition that affects individuals typically starting in preschool age. The original definition was earlier than age 7 is when symptoms are apparent and persist into developing adulthood and beyond. It's characterized by diminished attention, increased hyperactivity or impulsivity, or a combination of both, which is why you can have either inattentive type or hyperactive type or combined type. So the prevalence of ADHD is in 5% of children and between 2 and 7% in adults, with a male to female prevalence of 1.6 to 1, so more in males than females, where females typically present with inattentive type, but 20% of children with ADHD maintain their symptoms into adulthood. A good screening instrument for ADHD is the Adult ADHD Self-Report Scale, or ASRS, that is recommended by the World Health Organization, and it consists of 18 items and uses a 5-point scale for each item. There's a section A, which is truly the screen, and section B, which is a symptom severity assessment. In cases where there is ambiguity of whether it is ADHD or not, formal neuropsychological testing is also very helpful in those situations. The treatment for ADHD typically includes psychotherapy. Most people are focused on stimulant medications right away, but psychotherapy can be exceedingly helpful, and most treatment programs that are specifically designed for ADHD are rooted in psychotherapy-based interventions. And then we think about adding stimulants such as methylphenidate or amphetamines, etc., onto the mix. Now, that being said, for adults, there are strong data that medications such as bupropion or atomoxetine can be very helpful. These medications target both dopamine and norepinephrine and have even head-to-head trial data with methylphenidate, which is the classic one given to kids in treating adult ADHD. Monitoring for weight loss with the stimulants is very important. In fact, for children, we have to be very strict about monitoring height and weight charts to avoid anybody dropping off due to stimulant-induced loss of weight or not meeting milestones for height.